Hey there, nursing pros! Today, I'm diving into a critical skill every nurse should master: patient suctioning. This procedure is essential for clearing secretions from the airway, helping patients breathe easier, and preventing infections. Let's get right into it. First up, the types of suctioning. This one's for removing secretions from the mouth and throat. Perfect for patients who can cough but just can't get those secretions out. Here, you're dealing with the nasal passages and pharynx. It's often used for semi-conscious or unconscious patients with an intact gag reflex. Common in ICUs, this is for patients with an endotracheal tube, especially those on mechanical ventilation. Used for patients with a tracheostomy tube, essential for those needing long-term airway management. Now, when should you suction? Look out for these signs: audible or visible secretions, respiratory distress, low oxygen saturation, coarse breath sounds, and increased airway pressures on a ventilator. These are your cues to get that suction equipment ready. Speaking of equipment, let's talk preparation. Always start with hand hygiene to prevent infections. Gather your suction catheter, machine, sterile gloves, saline solution, oxygen supply, and PPE. Positioning the patient is crucial. Semi-Fowlers for conscious patients or supine with the head back for unconscious ones. Pre-oxygenate with 100% oxygen for a few minutes to prevent hypoxia. Connect the suction catheter to the machine, ensuring the pressure is set correctly: 100, 150 mmHg for adults, 80, 120 mmHg for children, and 60, 80 mmHg for infants. Now let's go step by step through the procedure. 1. Wear sterile gloves. 1. Insert the catheter gently without suction. 1. Apply suction while withdrawing the catheter in a rotating motion and limit it to 10-15 seconds. 1. Reassess the patient's respiratory status and reoxygenate if needed. 1. Dispose of the used equipment properly. As a nurse, your role doesn't end here. Continuously monitor the patient's respiratory status, prepare them for the procedure, and ensure all equipment is functioning. Watch for adverse reactions like hypoxia, bradycardia, or airway trauma. Always document the procedure details, patient response, and any complications. Educate your patients and their families about airway clearance techniques, especially those with chronic conditions. And remember, collaboration with your healthcare team is key to optimizing patient care. Safety considerations are essential. Avoid over-suctioning to prevent mucosal damage and bleeding. Use the proper pressure settings and maintain sterile technique to minimize infection risks. Continuous monitoring helps catch and manage complications promptly. In conclusion, patient suctioning is a vital procedure that demands skill, knowledge, and vigilance. As nurses, we play a crucial role in ensuring our patients' airways are clear and their respiratory status is optimal. With proper assessment, preparation, and execution, we can significantly improve patient outcomes and comfort. Thanks for tuning in. Keep up the great work, and stay tuned for more essential tips in nursing care. See you next time.